Hi, this is Todd Soura with Action Personal Training. I'm here with our usual guest, Dr. Eric Kephart of Kephart Integrative Medicine. And today we're going to be a little more conversational than usual as we're touching on subjects of both of our interests, which is exercise, fitness in general, the benefits of it, but with a little bit of a particular focus on people over the age of 45 or 50, and some of the misconceptions that are out there. And the first thing I would like to, I'll have Eric introduce himself first.
Sure.
Go ahead.
Sure. Yeah. Thanks, Todd. Yeah, we're here again discussing, and this is a topic familiar to both of us, and something that we're both passionate about. And you have spent, your life's work and career in helping others through this important part of how we can help people with their health and their wellness in life. So really excited to hear today from you, and to mix our conversation, as you said, and see how we can inform and educate our clients and patients out there, and those who are just looking for how they can be their best self. So
awesome. And the first, I like to open up with just your opinion on this, and I'll go there from the direction that I see it. And I know you and I see many things eye to eye, but very often I'll have a new client call us, and I'll meet with them and just make up an age, say 60 years old, 65. And they say, well, my doctor says, they only want me working out with 15 repetitions. And, usually that follows with me asking, well, why is that? And they say, well, the patients that they see come into their office with injuries, and so got them from lifting heavy. And then, of course, that goes into an additional conversation of what is heavy and those types of things. But let's just say it's usually about 10 repetitions of a weight that they maximize at 10 repetitions. And I always say, well, if you avoid that, you're actually going to be putting yourself in a weaker position. The reason many people get hurt doing 10 repetitions is because they do it improperly. They don't have they're not following the proper safety measures, perhaps using weight that is beyond what they should be using for 10 repetitions. Whatever the case may be, I go, but the one thing about doctors that you do not see are the patient. They only see sick people. So the people that are coming in with injuries are all they see, and they ask how they got that injury, and they say, well, I was lifting this heavy weight, blah, blah, blah. But what you don't see is the person who's 60 or 65 who is lifting it properly, perhaps had a trainer, perhaps didn't have a trainer, but whatever the case may be, they were lifting it properly and it was proper weight for 10 repetitions. And that same person, I always use slipping on the ice. That same person may go out on an icy day, 65 years old, slide on the ice, land on their back, hop right back up, and never need to see the doctor. And there's tons of those people, and that's always my point is doctors only see the people that are sick or got injured. They never see the people that are doing 10 repetitions properly in the healthy atmosphere and hop up from those types of things, and you never see them. So I would just like to see your opinion on someone who is in that age caliber lifting. Is it okay to lift that type of weight? And is there a benefit if so?
Yeah, I agree. I think that there are, in where I'm working and what I do see some healthy folks. We're trying to almost be that preventative type situation more than a reactive situation to an injury. We want to help people before they would encounter an injured part or have a medical problem that possibly could have been avoided. And that's what you're saying. We may fall, but how does the body react to that fall? How do we fall? And a lot of that comes into play with how physically fit we are. And that means strength. It means flexibility and range of motion, and how you're able to control your body. So those things are important to me for the quote unquote healthy or non-injured person. I think there are three things that everybody needs to really, focus on as far as health and wellness. And probably the first thing, and I think we should do a talk on this and have a lecture with an expert, is nutrition. We need to look at our nutrition. And then I think it's probably physical activity, exercise, or something like that, which is what we're going to address today. And then sleep, and that's another lecture too. But those three things are really important to our health and wellness when we are healthy and well. So we want to reach that patient population and make them the best they can be. To the point of exercise, and what I really like from a physician standpoint is this idea of a coach, an expert, or personal trainer. Those are the words that we're using, but I need that guidance, that expertise for the patient or client to ensure that they can safely work out. So that may involve some medical guidance, from my part, but safety in the exercises, the weight, the reps, and a goal has to be in mind. So we want a goal. And so those are things that happen whenever we sit down and speak with, a personal trainer. And then we can reach those goals safely with repetitions and weight that is appropriate for that person where they're at in their stage of life. And it's an all-encompassing type of a package, that you could provide for them. So, the weight in the reps and those things, if we want to be safe, we just say, just do 15 to 20 reps. That's an easy thing to say. But what is the goal and where does that patient go? I think there are some things that personal trainers, I wrote them down: guidance, motivation, accountability, safety, and then improvement or progression. If we stay where we're at, why are we spending the time? And I think the personal trainer, the coach, the expert there with you helps you reach all those goals, instead of me just seeing somebody in office say, okay, it's safe. I know you can go do 3 sets of 15 reps at 50% max, because you're probably not going to get hurt. Are you going to get any better or get benefit? That's, I kind of leave that go, from a physician standpoint. So we need the guidance, and the clients need that too, to get where they need to be, and to make the time and the effort worth it, from an exercise standpoint.
Yeah. I mean, I totally agree. And jumping into that, actually, I'd like to hear your opinion on this, because one of the things I talk about when we talk about just not being all about, of course you have to be safe, but you can be safe at many different levels of training. And one of the things I discuss with people, again, over the age of let's just keep it around 50, which is pretty much where I'm at. So, and with that is the importance of fast twitch muscle fibers. And basically, in a nutshell, I tell people that are some of these people are beginning training at the age of 50 or 60, and they just want to improve their quality of life. Many of our clients. And again, they go to their general practitioner and they say, well, you can lift some weights and do some cardio, but keep everything real simple and light. And that's where I come in and I'm like, what about your fast twitch muscle fibers? And usually that ends up with, well, what's the difference? What are they? In a nutshell, on my end, fast twitch muscle fibers is what I tell them are the power, the strength fibers. Again, going back to falling on the ice, they're the fibers that are going to contract and give you the strength to fall properly, get up properly, land properly, twist your body properly, whatever that may be, and have you get up, and also have the size, not to suggest that everyone has to be Arnold Schwarzenegger, but also have the muscle strength and durability to pop up from something like that. And as we age, those are the muscle fibers that go away, and they go away rather quickly. And I just want to get your thoughts on the difference between fast and slow muscle fibers as we age, and what we should do to keep them in the best shape that we can.
I think that's perfect, for you to mention that, we have different types of muscle, skeletal muscle, that do different jobs. We have the muscles that are contracting all the time to keep us upright in our back that are always contracted, and those are not reacting quickly to situations like a fall. And then we have the fast twitch muscle fibers that would make us be able to sprint down the track whenever we're young. And we don't think that, or maybe we don't know, we lose that fast twitch, and some of it gets converted to type 2, later on. And we want to train, develop, work out, use those fast twitch fibers in a exercise program so that, like you said, we maintain that fiber composition, within our skeletal muscle. There's always a combination, and from a medical standpoint, we can do tests to see, what is your fast twitch and slow twitch, muscle fiber composition. And you'll see that professional athletes who are extremely fast and quick, they have a high fast twitch, composition, and we're not trying to make people different than what they are. We want you to understand that we can work this into a program so that you can maintain this, and it has this benefit to you on the other side. And so that's great to even consider, that type of a program. From a physician standpoint, I think that we're not going to be able to give that guidance. So for you to see clients and then be able to explain that to them means all the difference in the world. Like you said, from a fall, and to be able to stand up and recover from it versus not getting more seriously injured because lack of control, lack of strength, and even and the flexibility component, which is part of a good program, is not there.
Good.